Hi, my name is Ellie, and I am a senior nursing student with Viterbo University. I previously have worked in long-term care as a CNA, and then I currently work at my local hometown hospital as a CNA in the ER and in the float pool. I spent my capstone in Belize, 2.5 weeks we did, so about 17 days. We were in a private hospital, a public hospital, and then a clinic as well. And we also did home visits with the local healthcare worker, Susan. So during this clinical, it was very different than the majority of the class that I'm in experienced, because it was in a completely different country, a lot of language barriers, a lot of just healthcare system differences in general. And it was a great experience, and my initial impression was that the facilities were not going to have as high-tech technology as we have here in the United States. And that's just because it's a newer country. I think it's only like 30 or 40 years old. And also it is a developing country still. And we were very close to the Guatemalan border. So I knew that we probably were going to be speaking a lot of Spanish. And what I didn't realize, though, that in reality is that a lot of these patients we saw were only Spanish speaking. So that was really difficult to get used to. But, I realized that I needed to learn some Spanish. And so realizing that, okay, there's a lot of Spanish speaking people here, I went to my host family and I asked them for probably 2 hours. We sat down and they talked to me in Spanish. They helped me with common phrases that I could use, asking people if they have diabetes or high blood pressure, or just simple things like, I'm going to take your blood pressure right now. This is your blood sugar number. And even learning numbers too was really helpful to me. And so my initial impression of the experience itself was that I wasn't going to be speaking as much Spanish, because Belize has politically, law-wise, its national language is English. And when you get closer to the coastal side of Belize, they speak a lot of English there. But when you get closer to the Guatemalan border, it's mainly Spanish speaking. And, I learned that firsthand when I was working with, the pediatric populations and parents, and the kids could speak English, but the parents could not, so it was hard to bridge the gap. And luckily, we had great nurses that were able to help us, kind of eliminate the barrier and translate for us, or, let us know what's going on, or teach us certain words and pronunciation that's different compared to, Spanish language in Mexico or even Guatemala. So I think I was able to achieve the goal of being able to communicate what I would like to do, how I would like to participate, as well as just in general communicate between providers and nurses and other support staff. I was able to really take the initiative of my own learning, and if I wanted to be in on something, I was able to do that, and I felt comfortable doing that. Whereas before, when I set this goal, I was a little nervous that I wasn't going to be able to do what I wanted to do and get what I wanted out of this experience. And luckily, I was able to very much so get what I wanted, what I needed, and it's really helped me grow as I start looking at becoming a registered nurse in my new position that I just received as a PACU nurse. And I think that the Spanish language is something that I really have taken away from this experience. I mean, it is something so incredible when you can speak to somebody and you can be, at the same understanding as somebody that doesn't necessarily speak the same language. And so I can bring that back here, and I can, when I have a Spanish speaking patient, I can at least understand simple terms that they come to me with, and I can communicate back to them that I understand them, or that I don't understand them, but I'll find a way to understand and call a translator. It was hard for me to integrate into the healthcare system and into the team because I didn't have that Spanish language basis. And so it was hard for me to communicate sometimes with providers, nurses, and then also the patients mainly. So it was nice to have nurses that were bilingual and were able to translate for me. I really appreciated that, but that was something I really had to get used to, and that's something I did not expect when I came into this experience. So my main goal coming into this experience was really to be able to communicate my existing knowledge of differences in cultures, and I feel like I was very much able to do that, and I was able to learn a lot about the culture in Belize and culture regarding healthcare in Belize specifically. I found that, it was really helpful for me to talk to the nurses, talk to the patients about, their own beliefs of healthcare and the historical perspective on it too, because it's a Mayan-based culture. And so that has a lot of effect on what they think of alternative health, current healthcare right now. So along with the Spanish speaking, I really think that it's something that I would like to pursue in the future because it's becoming more prevalent that there's multiple languages being spoken in the United States. And I think that Belize has really opened up my awareness of it now, because coming back to my job as a CNA, I just encountered somebody that's solely Spanish speaking in the United States, in central Wisconsin. And I think that it's just really important for them to feel comfortable talking to somebody who has at least a basic knowledge of Spanish, and that they can get their needs across. So I understand what their needs are, just simple. I think that being able to communicate with people is just very, very important, especially when you're the nurse and you're taking care of them for 12 hours straight. You get to know those patients, you get to know their family. So some of the main things I think that I've transitioned from the student nurse perspective into the graduate nurse perspective is cultural awareness. And I think that that's something very, very important, especially now with a lot of new people, new cultures, new identities, new perspectives coming into the United States. I think that's something you can take with you anywhere you go and in any practice you do. And I just think that being in Belize, it was very different, and I was the minority. I was in culture shock, and I think that not just in the hospitals, but even just walking around, you learn so much about somebody's culture, and you learn to respect it, and you learn how it affects their healthcare values, and you learn how it affects their daily life. And I think that's something very important that I've learned in this experience, is that it's important to know and to understand how someone's culture, somebody's religious beliefs affects their healthcare, because you're the one that is helping pave the way for their healthcare needs and for how they're going to achieve those goals. Another aspect of the transition from a student nurse to a graduate nurse is the amount of critical thinking skills I had to use. I wasn't necessarily always doing the physical aspect of the task needed, but I was sitting there observing, watching what their next move was, understanding what was going on, why they were doing it, why they were using evidence-based practice for the specific disease, for whatever is going on during the hospital stay or during the clinic visit. And I think that that's also something important, is that, you don't need to be physically active in touching, practicing skills. It's about critical thinking and, understanding the next step, or understanding why somebody's doing what they're doing. And I think that's something that Belize has helped me with, and helped me realize how important it is to use in everyday practice, because I think a lot of the times that we get caught up in just performing doctor's orders and just like, oh, they ordered this, this, and this. And I think we forget, why are we doing this? Why am I doing this in the first place? How is this benefiting the patient? I feel that Belize has helped me with this process of coming to the realization that I don't need to be an advanced person in physical tasks of putting in an IV. But what I can do is I can understand a disease, and I can understand probably what the doctor's going to order for this person, what I need to do as a nurse for this person to help them with a positive health outcome. The one example that comes to mind is the recent dengue outbreak in Belize. It's a mosquito-borne illness, and there has been a huge issue with it in Central America. So the Pan American Health Organization has a huge textbook of recommended treatments, symptoms, what to do with vulnerable populations. And I had the gracious honor of reading this book, and I began to understand and see the commonalities between this book and what they're recommending you do, and the actual doctors, doing these things, the nurses doing these, practicing these interventions. And it just really connected it for me as to, yeah, we have an evidence-based recommendation guideline, which is great, but are health professionals actually using it? Are they using these new methods, or are they sticking with their old methods? And I found that, they're abiding by these new recommendations because they know that this works. They know that this has been studied. Thank you for watching my TED Talk.